Dean talked about how he learned from Dr. Abaji how to make skin healthy, how to reverse the aging of the skin. And in those years, it was the early 90s, Dr. Abaji's products were just starting to come out and he started to make it available to the everyday plastic surgeons. Prior to that, it was only available through Dr. Abaji in Beverly Hills for the movie stars. But back then,
or by prescription formulations, but nobody had this transformative idea.
Yeah, like he put it all together in products that we could actually sell to patients.
Of rejuvenation and skin health.
So it's an interesting way that I actually personally got started with on the products. We went to what he called his Systems Day, and this is now going back 27 years by about this point. And I'm sitting in the audience with Dean, and we're watching his before and after pictures, and I'm just taken by his results. Like, this is just phenomenal that skin can change so dramatically. And at the time, I was like 40, and because we lived in Puerto Rico and Florida, I really was aging so badly. I had really had sun damage from the years of being in the sun for all those years. The wrinkles I was already developing at the age of 40. And I was taken back by, he showed one picture, a before and after, of a woman who literally was at 40, and then he's been doing this for 20 years, and a person who was 60, and he completely reversed her skin through those 20 years. Her 60-year-old pictures looked younger than her 40 years. And I thought, okay, we're going on these products. We are starting our practice with these products. And he's very aggressive with these products. And those patients who know these products know, you go aggressive, you're going to be
irritated,
raw,
red,
burning,
raw, rough.
So I listened to him at the time because I wanted those results. And his results were, you use Retin-A, these products, every single day. You don't let up. Well, I followed him to a T. And I used his products for 2 solid weeks, every single night. And after 2 weeks, I was as red and burning. And I thought, oh my God, I cannot do this with our patients. You know, only Dr. Abaji's patients would listen to him, but we cannot do it. So we modified it. And to this, and he actually, Dr. Abaji has since modified it as a result of our relationship with him over the years. And so now when you come to us and you get started on the skin products, you won't have that burning problem at all. We've learned how to work around that. And
Lori's developed many different ways for different people of color, of exposure to weather, exposure to the sun. They desire tennis, golf. Us, we love to be up in the mountains, hiking. So we're always exposed. But that doesn't mean that you can't get the benefit of Dr. Abaji's understanding in terms of skin health, rejuvenation, anti-aging.
So I think what's really important in my mind was how we got started with our patients and what brought the patients to us. And the interesting part is that Dr. Abaji taught us how to feel comfortable with people of color, how to use his products on people of color. And back in the 1990s, really, there weren't many doctors willing to treat the African-American individual, the Hispanic individual, because they didn't know how to take care of their skin. And so we felt pretty comfortable really learning how to deal with these products with the person of color. And to this day, our practice, our patients go back almost with us to 20, 25 years when we first got started. So we're very excited about the loyalty of people that we have created over the years.
As a compliment to Dr. Abaji, while we had a greater African-American population, he had a greater Asian and Arabic population. And he was able to take all the pigmentation from the sun, the dry skin, the oily skin, and improve it. And through his work and teachings to me, including the chemical peeling and the cream programs, and he developed very different types of rosacea programs, acne programs for patients all around the globe. Baltimore has become an exciting, interesting focus of patients from
We have the same global kind of diversity. Yeah.
global diversity, including the Mediterranean, the black, the African American,
The Africans.
the Africans themselves, right? The Europeans with their white skin, the Irish with their rosy, rosacea type skins. We've learned to work with all of these people and patients, men, women, and their need to be in the outside world as well.
So we're going to go and transition now into how we actually look at a patient, because now you know why we have such a passion for Dr. Obaji's program and his products. So stay tuned for how do we do a consult with a patient? How do we look at a patient? What are we looking for? So that's our next sequel.